We can take a look at your selfie and we can gauge when you may die. And using that information, we empower you to add 15 more years to your life.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my guest, Kavi Misri, CEO and founder at Hibiscus Health. Kavi, great to see you.
Great to see you as always, Logan.
So you're in the early innings of Hibiscus. When did
Correct.
when did you launch it?
I launched Hibiscus in June of last year.
Okay, so less than a year.
Less than a year.
But you've been making tracks. You've been doing a lot.
We've been hustling, yeah.
Okay.
We've been hustling and we've been building. And
Yeah.
We've just been building and building, yeah.
Which is partly because you've been moving quickly because this is not your first rodeo.
Correct.
You were the founder and CEO of Rose Health, which was
Correct.
a startup health company.
Yep.
But we're here to talk about Hibiscus.
Yep.
What is it?
Hibiscus is a preventative health company. So we leverage deep tech for early detection of metabolic conditions. In a very bold way, we can take a look at your selfie, and we can gauge when you may die.
Okay.
And using that information, we empower you to add 15 more years to your life.
Okay. So if I'm taking a selfie, and it's like you're gonna die tomorrow.
Yeah.
It's gonna
not as intense. Probably within the next 10 years. Yes.
I hope not the next
Yes,
10 years.
yes.
Okay. So why is a selfie able to give me a picture of my health?
So we use facial blood flow analysis, and the way that it works is that it's a 30-second video that's done through your smartphone. So you don't need any special equipment for this. It's just a 30-second facial scan. We look at blood hemoglobin, looking at the facial blood flow, and then running it against our AI model. We're able to then identify certain vitals that you may be at risk of.
How new is this technology? I mean, it
It's
seems
absolutely
pretty
new.
bleeding edge.
It is next gen. It is next gen. Like gone are the days of gone are the days of the skin prick test, as well as we still want you to go get your blood checked at the doctor's office
For now.
But this is a great way for us to identify patients early and also remove the barriers that exist that prevents folks from having their blood tested or from finding out that they may be at risk of high cholesterol or high triglycerides or even being pre-diabetic or type 2 diabetic.
Let's blow this out for a second and think about the sort of the moonshot vision here. What happens? What's life like 10 years from now if everybody in a population is able to get vitals from their phone every single day?
Yeah, I mean, we'll be such a healthier community with that, because data is power. Data is powerful. Being able to understand and be empowered by your data is even more powerful. So we're able to make these changes. It could be very small changes that have a major impact on one's health. And 10 years from now, it just allows us to capture all that data about ourselves and be able to really look at our vitals and check our vitals on a daily basis if we want, right? And it also changes the game for rural healthcare and for those that really don't have the access to this type of care. It's also the reducing the convenience aspect of it as well, inconvenience aspect, because instead of having to call your primary care doctor, get a physical in the next 3 months, then if they don't offer lab work there, have to go to Quest or LabCorp to get your blood taken. And at each stage, it's reducing the adherence of getting tested and really finding out.
Okay. Let's talk about your go-to-market, because you've got this breakthrough technology. You have your own version of it. You didn't invent the idea of this technology. Is that correct?
That's correct.
Okay, so this exists, this ability to draw this
so
data.
So we've used the subject data and the image analysis, where we've built our own AI model to detect the facial flow, and we are continuing to expand on the accuracy of it. So we're currently experiencing about 85% accuracy, up to about 95% depending on the vital. But we are actively seeing patients and getting more subject data by being able to get more patients enrolled and being able to use that to improve the accuracy of the platform.
Okay, talk to me about how you actually roll this out. Who are the clients?
Sure. Yep.
How are they responding to something that's so next gen? Because
Yeah.
sometimes there's some hesitancy.
Yeah. Yeah.
They're like, well, that seems a little
Yeah,
much.
yeah. So we are selling to self-funded employers, and they absolutely love the idea
Okay.
because the prevalence of diabetes and the prevalence of some of these metabolic conditions just continue to increase, and further, the cost of that care continues to expand as well. So it's a double whammy when you look at the cost of care for the self-funded employer. So they are excited because of a number of things. Not only are they able to have a healthier workplace population, but it has been shown that just people in general are want to be empowered and want to know about their healthcare. So they're also interested in, oh, you can see my A1C score, or I can test my cholesterol or my blood pressure.
Yeah.
So it is well received. We sell through brokers and consultants, so going to Lockton, Mercer, Garner, NFP, Aon. So reaching out to these broker consultants who then will speak with their clients and then bring us on board
Okay.
as a benefit. And one
Okay.
of the beautiful things about it is that we are as a digital first company or as a digital front door, we really sit at the top of the detection
Yeah.
and being able to identify patients who are at risk, and then we can create a care plan, and then also help with the navigation of care. So we're not reinventing the wheel. We're not reselling them a solution. We're using their existing products, like if it's diabetes, for example, if they have Livongo or they have Omada or they have Verta or Vita, we're actually empowering those companies.
Okay.
So we're sitting on the top and we're identifying and screening the patients at a very high level, about 60 to 70% being screened. I mean, just think about how much time you spend waiting for a Zoom meeting. In that 30 seconds of waiting for a Zoom meeting, we could scan your face and we can identify, then we can get you to the appropriate care teams and navigate you to Omada or Livongo or Verta or Vita.
Yeah.
And then it becomes a win-win-win when you think about it, because Omada, Livongo, Verta, Vita, they're getting higher engagement from us because we're pushing more patients to them. The employer is happier because they are able to have a healthier workforce, lower cost of care, and then the benefit brokers are happy as well because they ultimately can say that they've sold a really beautiful product
Yeah, yeah.
as well.
Maybe this is getting too in the weeds, but
Yeah.
what's to keep Omada and Livongo, those types of companies, from incorporating this kind of technology
Yeah,
into
so
their
that's
assessment?
super fair. So it's something that we've seen that it's something that they would purchase versus build. We've spent a significant amount of time building this technology out, working with Johnson & Johnson Innovations. So we're a Johnson & Johnson portfolio company working with J Labs to really look and work on adding more patients to this. Also, being able to have the algorithms to be able to intercept the facial blood flow, the pixelation,
Yeah.
that's something that would require a lot of work. The way that we see it is being able to identify the patients and then let Omada, Livongo do what they do best, which is care for the patients.
Yeah.
Just hand the patients off and then be able to have a healthier workforce.
Let's talk for a second about you as a CEO and
Sure.
founder. This is your second startup health company.
Sure.
We had Rose Health before. How are you running Hibiscus differently
Yeah.
because of the experience you had at
Yeah.
Rose?
Oh, that's such a great question. I think I'm building faster. So I think we've been able to build what I've built so far
It
at
seems like it.
Hibiscus,
It
yeah,
seems like it.
what would have probably taken me about 3 or 4 years at Rose, I have a better ability of building a top-notch team.
Mm.
I know the red flags, or at least I know the type of people that I want on my team, and I continue the model of building with leaders. So everyone at Hibiscus is a leader in their own space. So I trust that they all know what they're doing. We all have the high achieving goals that we want to set, but each person knows exactly what they have to get done to make that ultimate goal
Yeah.
possible. And then it's also the ability to really just build faster and be in a position. Also, the network is huge.
Yeah.
Having the network that I
Yeah.
built at Rose and being able to leverage that, like you, for example, I mean, it's golden. It's
Yeah.
just like it's so powerful having the network and being able to really get what I need done at a quicker and
Yeah.
faster level.
I mean, speed's everything.
Speed's everything.
Speed's
And,
everything.
yeah.
Time
yeah.
is money.
The one thing that I do find interesting is like we build a lot, but we don't really break. I know the model is always just like build and break, but
Yeah.
we're not really breaking much. I
Move-
mean,
yeah, they
we're
say
yeah.
move fast, break things, and then a lot of people are pushing back against that in healthcare and
Yeah,
saying
we're not
you
really
don't really
breaking.
do that.
Yeah, we're not really breaking much. We're really spending a lot of time, I guess, transforming the way that care is delivered and providing more of a precise. And also, I think it's also coming from the background of Rose as a deep tech company, being able to understand the deep tech nature that Hibiscus Health can bring,
Yeah.
and that next gen ability to really identify certain concepts early or identify diseases early and be able to treat it. So kind of a combination of both the care meets the actual early intervention.
Well, Kavi, I appreciate you stopping by.
Absolutely a pleasure,
It's
as
kind of
always.
kind of amazing.
Yeah.
It's been less than a year since
Yeah.
you launched. A lot's happened. It's exciting to see how you have become a complement to folks like Livongo and
Yeah.
Omada, and this screening tool is so huge. So I'm excited about the technology and where you're heading with it, and we're
Yeah.
going to keep watching what you do.
Love it.
Okay?
Yeah. Thanks as always,
Thanks,
Logan.
Kavi.
Appreciate it.